Rishita, Manjusha is there?
Ma'am, I'll have to check.
Please check.
We are live.
No, she is not there.
We are live on YouTube now.
Now all can mute their mic.
Yeah.
Except Rishita. Rishita, Manjusha is there. It is good to go.
Okay, sir. So shall I start?
Yes, sir.
Wait a minute.
Devina is there. Good evening, madam. Devina, ma'am.
Devina,
Very good evening. Very good evening.
Principal Dr. Sister Alice Thomas.
Very good evening.
So it's right 5 o'clock now. So, sister, shall we start with your permission, please?
Yeah. Now it's
Okay.
6 o'clock. Start.
It's already 6. Sorry, it's already 6 o'clock. So, Rishita, please, with permission of sister, we can start it now.
Yes, sir. Greetings to everyone. This is Rishita Shukla, your host for today's event. I deem it a great pleasure to welcome you all to this international webinar on menstrual health awareness, breaking the taboo, that has been organized by the Department of Humanities of our college, St. Paul Institute of Professional Studies. In the light of the current era of modernism, often minute things like little taboos can cause a big hindrances. That is why today's topic is very necessary for a mental revolution among us. So, for the smooth conduct of this event and for the welfare of all, I invite Ms. Manjusa Aint to invoke blessings from the Almighty with her holy prayer. Manjusa, please.
Let us close our eyes and fold our hands and be ready for prayer. All-powerful and ever-living God, we humbly thank you and praise your glorious holy name. Thank you for this day and especially for this hour, our good health, sound mind and spirit. Dear Lord, we seek your graces and blessings in abundance for this event and our dearest resource person for this session. Guide and direct her by your divine spirit so that she may explore her keen knowledge about the topic and we may acquire knowledge for our better well-being. Lord, bless each and every participant of the session and grant your blessings so that this program may be successful. We ask these blessings in the name of our loving Father and of the Son and of the Holy Spirit. Amen.
Thank you so much, Manjusa, for your soulful prayer. Taking forward the program, I would like to invite our beloved principal, Dr. Sister Alice Thomas, to bid an encompassing welcome to each one of you tuned in with us today. Sister, please.
Thank you, Rishida. A blessed good evening to one and all present here in this international webinar. Especially, I welcome Dr. Devina and all the participants from different parts of the nation or outside also. Hearty welcome to St. Paul Institute of Professional Studies, Indore. First of all, I congratulate the Humanities Department for conducting this debate. Undergoing depression, tension, anxieties, all these things. So I hope
this seminar will help them or inspire them, motivate them. Once again, I welcome you all, and may the loving Father keep you safe in his loving hands. Okay, once again, I thank you for coming to this seminar and welcome you. Now, I think this Rahat sir, head HOD of the department, will give another blessing words. Thank you. God bless you all.
Thank you, sister. Thank you. Thank you very much. So as sister has again permitted me to welcome. Okay. Thank you very much, sister. So another good evening to all the members on this virtual platform this evening. I, Professor Rahat Ahmed, take this honored privilege and opportunity to welcome our director, Reverend Father Simon Raj, our beloved principal, Dr. Sister Alice Thomas, who had been incessantly motivating us, encouraging us to give the best to our students under this pandemic as well. We are really thankful to them and welcome them to this international webinar. Thank you very much, sister. Thank you very much, Father, and welcome you to this international webinar. I wholeheartedly welcome the resource person of this evening today, who has all the way come from United Kingdom to India. Though she's sitting there, but her message to all of us is going to be really very fruitful and valuable. That is Dr. Divina Tyagi. Wholeheartedly, on behalf of St. Paul Institute of Professional Studies, we welcome you, Madam, on this virtual platform. I wholeheartedly welcome the department members, all the members of SPIPS family who had been looking forward for this international webinar, because this webinar is little bit different from the academics, as Rishita has already told, and this session is going to be beneficial for all age groups of people. It is not only related to the academics, mostly it is related to the women. And not only women, the men should also know through this seminar the problems, the issues faced by the females. And they should always believe that because of women, the men are existing on the earth, and they should have due respect for women. I welcome all the viewers, as sister has already welcomed. I also welcome all the viewers who have joined this session from all over the country and even from abroad. Hope this session is going to be very fruitful for every individual. A warm welcome to all of you once again on behalf of St. Paul Institute of Professional Studies, Indore. Stay happy, stay healthy, and enjoy this session. Thank you very much. Over to Ms. Rishita.
Thank you so much, sister, and thank you so much, Rahat sir, for such a warm welcome. And now the time has come to appraise you all to a very special person that we have today. We are privileged to acknowledge among us the presence of Dr. Divina Tyagi Sharma, joining us all the way from London, United Kingdom. Thank you so much, Divina ma'am. We are extremely indebted to have you here today. So, to provide you with a program compact brief of Divina ma'am, I would like to invite Professor Toleka Mukherjee. Ma'am, please.
Thank you, Rishita. Am I audible, Rishita?
Yeah. Yes, ma'am, you're perfectly audible.
Okay, thank you. We are delighted to offer the most hospitable welcome to our dear resource person, Dr. Devina Tyagi Sharma. Indeed, it's my great pleasure to introduce such a vivacious personality who has staunchly devoted her life into the noble service of providing and promoting physical and mental health. Dr. Sharma, a member of the Royal College of Psychiatrists, who will be enlightening us about the menstrual health today, holds an MBBS, MD in gynecology and MSc in applied public health. She is currently resides in London and is a part of Wisdom Mental Health Liaison Service, which works closely with acute trusts
medical and nursing colleagues, as well as occupational therapists, physiotherapists, social workers, and other allied health professionals to provide good standard of care to the patients. As a consultant, she establishes, develops, and maintains positive relationship with colleagues and other associated teams. Dr. Devina and her licensing team provide clinical and psychiatric support to the individual suffering from the disorders of mood, depression, anxiety, mania, psychotic illness, psychological reactions to physical illness, somatization, schizophrenia, autism, substance misuse problems, etc. Our esteemed speaker has an experience in the field of maternal and child health, applied public health, general adult psychiatry, and licensing psychiatry. Dr. Sharma has audit and ward-based teaching experience with the medical students and acute hospital staff. In addition to all these expertise, our guest speaker has numerous posters and publications to her credit that includes the social causes for spreading awareness and issues based on clinical setting, respectively. She has also attended several conferences and continuing professional development events. Madam Speaker has not only excelled in her professional life, but is successful in her personal as well by carrying an energetic and optimistic approach. She always possesses a thirst for knowledge and has an excellent interpersonal and communication skills. She is truly an epitome of excellence. Undoubtedly, Dr. Devina has proved that the distance between you and everything you want is the amount of action you take, and her hard work reflects in the outcome. We welcome you again, ma'am. Indeed, it's our good fortune that we have a dynamic and competent person like you as our resource person who has graced the session to eliminate and create awareness by breaking the taboo about the sensitive subject of menstrual health. So I would request our compere of the day, Ms. Rishita Shukla, to formally request our resource person of an international webinar today. So let's lend our ears to listen to the words of wisdom. Over to you, Rishita. Thank you.
Thank you so much, Toleka ma'am. And finally, just as Toleka ma'am said, it's time to set the event in motion. So without any further ado, I invite our resource person, Dr. Devina Tyagi Sharma, to share her imperative words of wisdom on this subject matter with all of us. Ma'am, please.
Thank you very much. Really, really kind of you, all of you, to invite me for the event. And I would like this event to be as interactive as possible. But just to, again, I think the break the ice, we can have a couple of minutes maybe to talk about the issues we are going to start talking about, and then I would like to take questions as and when you require to ask questions. Don't hold your questions back. Don't wait for my presentation to finish, because I don't have a big presentation at all. I've spoken about it. It's not an academic presentation. It is about knowing what we have around us and acknowledging that we need to do something about it, whatever we can. Yeah. So who's holding the control of the slides? Is anyone holding control of slides?
Ma'am, I'm holding. I will be sharing it.
Thank you very much. So if you go to the first slide, and I always question, and I think this is the ethos of my practice, it's about understand why about everything in our lives, in our clinical practice, in our relationships. So first question I am asking is why you should listen to me. What is it that I bring? And Tulika Mukherjee has mentioned about my sort of CV, and that's fine academically, whatever it is. But looking at my sort of journey in medical fields, I started my MBBS, and then I was practicing as a gynecologist, obstetrician and gynecologist. And then I wanted to do a little bit more. So I have done a little bit of, not a little bit, quite a lot of public health So when you say public health, it's about the population-based. So obstetrics gynecology is quite part-focused, women-focused field. Then I have done the population-based work, which is public health. And then I have gone to mental health, which is where I am a consultant now. So liaison psychiatry is the interface between physical and mental health. So when we talk about mental health, it's about, we cannot depart these two things together differently. Your physical health will impact your mental health, and your mental health will affect your physical health. And that is where I come from. That is what my liaison work is all about. And hence, when you look at the menstrual sort of awareness, my obstetrics background fits in, my public health background fits in, and the mental health background fits in. So I can sort of, and that's the reason why I possibly is more entitled to talk about this. Yeah, that's my rationale. That's why I'm suitable for this talk. Now, the second why is about why menstruate. I would like to sort of question that. Do we have a choice as women? Do we have a choice to menstruate or not to menstruate? We don't. There comes an age where suddenly you bleed. And it's quite anxiety provoking, isn't it? Because it is not something like fracture that you can see in someone's arm or legs or head injury, like a band-aid or something. This is so personal that people have not spoken about it. So this is something to understand, that we don't have a choice. And for men to understand that women, they do not have a choice. They will menstruate. Yeah, and throughout the life, we have 3 stages of menstruation. One is the start of menstruation, which is menarche, which is very anxiety provoking. Women panic, girls panic. We can talk about it. Then a big phase of our lives are menstruating every month. So it's the reproductive life. Yeah. And the third phase is it pauses. So it's a menopause. And every stage has its own complications, has its own issues, has its own dilemmas, and has a lot of unawareness on every cycle of our lives. So that's where my question lies with women as well as men. That when we say we menstruate, we don't have a choice. Just for a second, reflect on it. Something is out of my control. Something is out of your control. Yeah, and we will have that every month from the start of our periods. To live with it. Yeah, hold that thought. There is I'm sure everyone knows about why menstruation happens. Most of the people know. Some men might not know. Some women might not understand, because when I speak to people, people have talked about being a dirty blood coming out of your body, excess blood coming out of your body. So quite sort of generic sort of words they have used. So I'm just wondering if we can play a 3 minutes video for everyone to understand that what is this physiology of menstruation. So in a nutshell, what I can sort of tell you is the interplay of hormones, is the interplay of estrogen hormone and the progesterone hormone. Yeah. And basically, every month, we prepare ourselves to be pregnant. I wonder if we become pregnant every year, where would we go? That's a different question. But our body doesn't know about it, so it prepares itself. Yeah, and when it fails to become pregnant, when the ovum fails to be fertilized, it sheds off. So it's the preparation of becoming pregnant and then not being pregnant, and that is being sloughed off. So where does the thought of being dirty comes in? How many people it's a very, very open question. How many people think that menstruation or menstruating blood is dirty blood? I'm sure most of us feel it's dirty. Yeah. But if think about it, if I have blood on my finger, it is not dirty because I chopped something and cut my finger. It's not dirty. Everyone runs to get a plaster, but when it is the blood coming from the uterus, it becomes dirty. Yeah. Hold these thoughts. It's important. How we utilize our vocabulary to talk about it. I think it's very, very important. Once I've heard a word dirty, it will be propagated to my next generation or my siblings. And that dirty words might not have any meaning, but we will continue to use it all throughout our lives. Yeah, just hold these thoughts because I think these will bring a little bit of discussion and generate a quite sort of dynamic conversation. Yeah, so if you can just go to the 3 minutes video and see if, just for people who really don't have that understanding, because we have quite a varied audience, isn't it, from very young to my age kinds, men, women. Yeah, so everyone have very, very different understanding. So we can just play that and see if people want to bring any questions at this point, any issues, we can talk about it. Would that be okay? It's Irene, right?
Yes. Shall I start the screen
Yes.
sharing? Okay.
Yes, please.
My screen is visible.
Yeah. Is there any issue with? Yeah.
The sound is audible, ma'am.
Yes, it is. It's not working at this point in time.
Starting your period is an
Audio is working, but video is not.
Video is not showing up. Yeah.
important moment. But what exactly is a period? And why do millions of girls get their periods every month? Having a period is a sign of health and fertility. It's part of a monthly process called the menstrual cycle, which is the body's way of preparing itself for a pregnancy. On average, the menstrual cycle lasts 28 days, although anything from 21 to 35 days is normal. The cycle is regulated by hormones, little messengers produced by the brain and ovaries. It has 4 phases: menstruation, pre-ovulation, ovulation, and premenstruation. Menstruation is when the lining of the uterus is shed through the vagina as menstrual fluids. This can last anywhere from 3 to 7 days. You only lose about 4 to 12 teaspoons of menstrual fluid during your periods, and not all of this is blood. In order to stay confident and protected during this time, try Always Radiant Teen Pads. They are made of flex foam so they can be thin and flexible without skipping out on protection. During the next phase, the brain sends messages to the ovaries and uterus to produce hormones called estrogen and progesterone. These hormones prepare an egg for release and cause the lining of the uterus or endometrium to thicken. You may notice thicker vaginal discharge around this time and choose to wear Always daily
No, video
liners
is
to
not
keep
there.
you feeling.
Video is not coming.
No, only audio is there.
Just a second.
If it is not working, don't worry about it.
I'll try once more if it works.
Now I think
Is it visible?
yes. It's about to.
Menstruation is when the lining of the uterus is shed through the vagina as menstrual fluids. This can last anywhere from 3 to 7 days. You only lose about 4 to 12 teaspoons of menstrual fluid during your periods, and not all of this is blood. In order to stay confident and protected during this time, try Always Radiant Teen Pads. They are made of flex foam so they can be thin and flexible without skipping out on protection. During the next phase,
Ma'am, still it's not visible.
No, it's not. So I think we can leave it. I can sort of, I've already spoken about it, what really sort of menstruation is all about, isn't it? It's about preparing yourself. So I think we can move on. It's not a problem. And most of the students and audiences who are really, really interested in, just Google menstrual cycle and see what it is all about. I think physiology is very important, why our body produces blood and why it only happens in women and not in men, right? So I think if you have that knowledge, that's fantastic. If you don't have it, go onto YouTube, just type it in and see what you understand out of it, yeah? So as I was saying that, it is a normal physiology. As we eat food, we go to the toilet in the morning. It is normal. Yeah? Nothing extraordinary about it. Same with menstruation, but the only issue is because it is the interplay of the hormones. It happens at a particular age, and it happens only up to a particular age. And the purpose is basically the creation of the next generation, creating a life. That is the purpose of your uterus and your ovaries. And it prepares every month to become pregnant and reproduce. Yeah, and that is the creativity part of it. Now think about it as a topic. I think it's really important to understand half of the people, half of the world menstruate. There's a massive population of women, reproductive age women, and we still don't talk about it. It's an irony, isn't it? Think about that, something that every woman goes through, but we still don't talk about it. What stops us talking about it? But before going on to what stops us, think about why it is important to talk about it. Why is it important? It is important because it impacts everyone. It impacts me, and it impacts you. It impacts your daughter, your mother, your colleague, your neighbors, your maid, because they are women. But this also impacts men. It's the relationship between a woman and a man, brother and a sister, father and a daughter, mother and the son. So everyone needs to know about it. Yeah. So I wonder if you have thought about that, why this awareness day, menstruation awareness day, which I call it MAD, is like, yeah, it's easy to remember, isn't it? Why is it on 28th of May? Have you thought about it? Anyone? Any guesses?
Yes, ma'am. I know.
Please go ahead.
Ma'am, because menstrual cycles are 28 days, and 28 means 5 is for the menstruation days, 5 days.
Absolutely. So there is definitely a reason why they have specifically put it on 28th May, so that people know that it's a 28 days of period-free cycle and 5 days of periods, right? Now think about, why is it important health-wise, education-wise, economic and environmental effects, and human rights. So think about now, anyone shout out loud to say, why is it important? Why is it important to talk about menstruation? What is the impact on health? What are we talking about? Anyone?
Ma'am, can I try?
Yeah.
Ma'am, because I think all through these years, especially in a country like India, menstruation is really appended to mental health and social stigmas. And for any country's development and for a person's his own development, I think it's very necessary to work on these hindrances that might cause a very big issue if they are not treated properly at the right time.
Absolutely. So we're talking about health, we're talking about physical health, and we're talking about mental health. Yeah. So when we talk about physical health, we're talking about reproductive health of a woman. Yeah. Imagine someone is using bad stuff, unhygienic stuff. What kind of infection they might be sort of alluded to, or they might get infected with, we don't know what. It could be fungal infection, bacterial infection. And then once you have infection in your uterus or your vagina, it is hard, and that impacts your reproductivity, right? So your fertility, that's the question. Now, this is important to understand. Whenever a woman cannot bear a child, how many times we blame it to a man? How many times we question the fertility of a man? We don't. As a society, we think about, it's all about women, isn't it? So if women, as a woman, if you are given such an important pedestrian to say, you know what, you are the creator of life, then it is important that we look after her health as well. Yeah. So physical health, reproductive health, sexually transmitted diseases. Yeah. So these are the physical health complications. Anemia. We don't look after women, bleeding women. So there is, let's say, 4 to 5 tablespoons of blood. That's fine. But if you know that bleeding more is going to deplete you from blood, that means you need to look after yourself as well, isn't it? So health in every aspect we need to be looking at, the physical health. And the impact of that, mental health. If someone has not been able to bear a child, have sexually transmitted diseases, anemic, it will impact your mental health. They will have poor self-esteem, potential depression, and then the society we have, it's the stigma of not having a child in itself is a big one, right? So it's all interplay of mental and physical health. So we cannot tear them apart. Yeah. So that is one. Second thing about education. So why it is important to talk about this? Historically, if you look at the data, people have sort of cited that maximum dropouts of teenager girls from school is because of menstruation, not having good facilities. It's not as much in urban areas, it is more in rural areas. I understand that. But think about our society, an urban population. How many times you would like to miss your classes when you're starting periods? You say, I'm not feeling too good, I'm not coming. Yeah. So it's about knowing what is menstruation, knowing how I might feel, what are the symptoms, and also knowing what I can do to make sure I feel healthy. That's what awareness is all about. It's not about let's shun it. If I'm not going to school, college, university, whatever it is, I am missing out on my opportunities. Yeah. So that's the impact on education. Again, there is a massive divide between rural and urban, and I don't think we can compare rural and urban needs and requirements at this point in time, because that is a different. If we start talking about it, it's a different Pandora box. We have loads of issues relating to rural awareness programs. Yeah, many NGOs are working on it. Now think about it as impact on economy. If your colleagues don't understand the impact of period, of menstruation, there is a potential that they might not understand that you might feel a little iffy on those days. Yeah, they might question about your absences. They might question about your performances instead of being supportive. Now imagine for a minute if someone drops down with, say, low blood pressure and falls down on your corridor. Everyone will come and support them, isn't it? They will give them water, they'll give them sugar, they'll call the ambulance or whatever it is. But when someone feels iffy during those days, nobody knows about it. And because nobody knows about it, nobody helps them. So these are pointers to think about. Are we checking in with our colleagues? Are we asking our colleagues, are we talking about it? Yeah, so that's the economical sort of what I say is impact, that you'll have few sicknesses. Not everyone will have similar symptoms. Some might have severe symptoms. We're going to talk about it a little later. So that's the impact on economy. Then we look at the environment. Now think about what are we using to protect ourselves. So there are multiple resources to use to support bleeding, but then how are we disposing them of? It's a question, isn't it? Because it will have environmental impact. So, and third thing I always wonder is, we talk about right to education, we talk right to choose. Do we really honestly giving the rights to our girl child? Are they really choosing? They possibly are not, because possibly they're not talking about it. Possibly nobody is talking about menstruation, which is going to be with her for next at least 35 to 40 years. Nobody's talking about it. So how are we saying that she has the rights? Because we assume that she knows about it. I think this is again something to think about and reflect on, that half the time we think, because I know, and hence you know, which usually doesn't happen, isn't it? Unless I ask you, are we on the same page? This is something to think about. Yeah. So these are some of the reasons why this topic is so important. Yeah. So now looking at the symptoms, really. So we can easily divide it into physical symptoms and psychological symptoms. So physical symptoms, very easy to sort of look at. Some might feel a little achy. Yeah. Some might not have any symptoms at all. But again, depending on everyone's very different, it's very personal experience. I cannot say that, you know what, I don't have any physical symptoms and hence you shouldn't have any physical symptoms. No, I can't, because it's your body. Yeah. So you might feel a little achy, you might feel a little fluish, flu kind symptoms, you might feel feverish, headaches. These are very common symptoms, but not happen to everyone. But most women have that. Psychological symptoms, I think, are more, they go under the radar. People don't pick on those. Psychological symptoms are like a little bit irritability. You can't sleep properly. You might have hot flushes. So you change in your mood swings, we call it. But they're very common. And people will notice in the family, oh, you're becoming quite irritable now. And you can, if you chart it, you will see that around the time when you are starting your periods, you will become a little more snappy. Yeah. But if you know about it, then you can do something about it. That's the important thing, isn't it? It's about your self-awareness as well. And awareness for the people as well, so that they are a little bit more tolerant. Yeah. So when we talk about psychological symptoms, there are two things we talk about. One is the premenstrual symptom or premenstrual tension, which I've just spoken about. But sometimes it goes a little beyond just the symptom. It becomes premenstrual dysphoric disorder, which is like every symptom we talked about: irritability, feeling a little bit snappy, having mood swings, inability to sleep, but top notch, maybe for 5 times or 10 times. So you're not able to sleep at all. Your pain is severe. You are very irritable. You have lost your appetite. You're not able to eat anything. You feel low. You feel down. You feel depressed. And that is what premenstrual dysphoric disorder. But not everyone will have it. Again, it's about knowing what the symptoms are, and not just for the women, also for the men in our audience. If we know the symptoms, we understand the physical as well as psychological symptoms, we can possibly put some sort of remedies and support. Yeah. So when we talk about treatment and management, very simple stuff. Every mom says, take hot water bottle and lie in the bed. How many of you have heard of it? I'm feeling achy. Hot water bottle in the bed. Adrak ki chai in the bed. Haldi ka doodh in the bed. Very common remedies. Very helpful. But we possibly need some paracetamol, maybe some analgesics, maybe antispasmodics. That's a very simple over-the-counter remedies. Yeah. But if we are talking about premenstrual symptoms and premenstrual tension, only then. But when it comes to premenstrual dysphoric disorder, which is more of a mental disorder, not, I won't say disorder, but illness, then you will need a little bit extra than just plain analgesics and supportive therapy. So you possibly will need some hormone therapy, a regular cyclical hormone, to curb the impact of your mood swings. Yeah. You possibly need a psychological support. I don't know whether you've heard about cognitive behavioral therapy, which is like understanding that we I have this problem, and identifying that these are the times when I struggle with, and what do I need to do before that. So actively working on it. Yeah. And then supportive treatment. There's a massive evidence that, going for a massage, maybe hot shower, hot bath, eating a less spicy food helps. Again, not scientific. Anything that helps will help us. Yeah. And I think anyone would feel that environment is much manageable at home when the lady of the house is in good mood. So it's important for men to understand how to keep the women of the house happy and support them. Yeah. So if we go on to the next one, any questions, by the way, before we move on to the next one so far?
Ma'am, I just had a small doubt.
Yeah.
Usually we go through a pain during the periods.
Mm-hmm.
Some people don't like to pop a pill and feel better.
Mm-hmm.
So how to deal with that part?
Okay.
Without popping a pill, how to feel better?
So when we talk about pill means what? Is it the painkiller you're talking about, or we
Yeah,
talking
people
about?
do prefer painkillers and some other pills. Like some try to take combiflin and stuff.
Yeah.
But they do have side effects on our body. So what kind of remedies we can take? Like,
Okay. There are two questions in this, and I would throw it back to you. One is when you say side effects, how many times you drink Coca-Cola or Thumbs Up or Pepsi?
like twice in a month or something like that. Yeah.
Mm-hmm. How many times you eat chocolate cake and the cream cake in the market? How many times you know how many additives it has? We don't. Yeah. So when we talk about side effects, it's yes, if you are having paracetamol every day for so many months, it will have difficulties. Yeah. But if it's only to manage that particular symptom, having a painkiller is not a problem. First thing. Second thing, your question was, what if someone doesn't want to use the medication? Yeah. And perfectly fine. Again, it's about the choice. So the choice is, how can we minimize the discomfort? Yeah. So that you don't need to take painkillers. Yeah.
Yeah.
Yeah. So one is, usually if you can manage your cycle, if you know, if you can sort of chart your cycle, so usually if you do your physical activity 2 or 3 days prior to that, if you increase your physical activity, that will help to loosen your pelvic muscles. Yeah. So basically the pain that you experience is the spasm in the uterus because it is getting rid of. Okay. So if you increase your physical activity by a little bit prior to your periods, that would help to reduce your pain. That is one. Second is, as I mentioned about supportive therapy, maybe a bit of massage, maybe also hot bath or hot water bottle. That helps. Now, third thing is very important. Again, it's tricking your brain because we have associated period with pain and discomfort. So how about when you know that you are going to have period, how about giving yourself a little bit of TLC, like a little bit of care to yourself? If you plan to go for a haircut, instead of doing it on those different days, why not to do so that you're distracted a little bit? This is how your mental health distraction techniques help. Yeah, is that all right? But
Yes,
I would say, from my point of view, popping a pill to relieve your discomfort is not an issue. It only becomes a problem if you use it without any discretion. Yeah.
Yes, ma'am. Thank you so much. Thank you.
So, any other questions before we move on?
Ma'am, a small announcement. Sorry for disturbing you, but all the viewers who have joined us from YouTube can ask their questions in the YouTube chat box so that ma'am will reply to it later at a very convenient time after she's done with her whole session. Would that be okay for you, ma'am?
Anytime, I don't mind. Anyways, whichever way.
Okay, ma'am. Thank you so much.
Okay. Shall we move on to the next one then? Next slide. Irene, are you still here?
Yes, ma'am. Yes, ma'am. I'm doing it. Yeah.
So I think this is a very basic sort of information, which I just wanted to put it in here. It's about, now you know why women menstruate. Now you know there is a little bit of physical and psychological symptoms. Now it's just about making sure that we have ample support to look at the hygiene of our women. So basic stuff, which possibly not every place will have, but we can aim for. Again, not an issue in urban areas. It's about having facilities, proper toilets, soaps, water, enough water. Because when you go to some places, you go to the toilet, you will find that the toilet is not working. So what's the point of the toilet, right? You need clean hands. You need wash and so these are very basic stuff. Again, massive difference between rural and urban areas, but we can always aim to go towards the gold standard. Very simple sort of next concept is about the sanitary products. I'm sure many people know about it. Some people might not have heard about it, but you would be surprised to see or hear that around 2% of women, they don't use anything. They just don't use anything. They have no idea what to do. And that again is not something, they are more vulnerable there, isn't it? Because they are out and open. That we need to protect our women. We need to protect our girls. So again, there are loads of, so they're branded pads and sanitary napkins and tampons and those kind of stuff. But there are very, very basic homemade napkins, cloth, clean cloth, tampons. You can't, I'm not really sure about, you shouldn't be using any homemade tampons. But very interestingly, I was reading about this and someone spoke about that they spoke about this issue they made, and then she said that we're not allowed, we use cloth, we wash it, but we're not allowed to let it dry in the open. So my question was that if you're not drying it in open, how are you drying it? So either in their own room or under the bed. So you can imagine what kind of infection are they bringing in. So these are small questions to think about, talk about to your people around, underprivileged people. Just talk about what they use. Do they need any help? And they're very, very cheap, but I would say locally made sanitary napkins available through various NGOs. So it's just about linking them in and making them aware that why it is important to use a hygienic and sanitized protection. Tampons is it's not new, but they are very convenient. But again, you have to use it inside the vagina. It's very convenient to a point that someone can go to the gym if they can swim and just normally use it and change it as you use and change pads. The latest product is the menstruation cup, which is more about disposable. It's reusable. But it's about how to use it. And are we open to that idea that we can have a product which we can wash and clean and keep it in our purse? So again, this is something to think about. One of the most sort of innovative inventions, I would say. So when we're talking about the sanitary products, so when we talk about cups, if they are reusable. You can wash it, clean it, keep it in your purse. That's fine. When we talk about cloth pads and tampons, how do we dispose them? Have you ever thought about what's the best way of disposing them? Anyone? Any idea apart from putting in the bin? Okay, so
Ma'am,
yeah.
We can clean the cup, throw the blood, and then we can boil that cup, and then we can reuse it again.
Absolutely. So cups is not an issue because it is reusable. We're talking about pads, tampons, and cloth. How do we dispose? How ideally we should be disposing them?
Mama, I think there is a machine or something that is made for them, and we put them, and then it cringes it all. That's how it should probably be disposed.
Ideally, gold standard is incineration. Yeah, you're right. But because now the drive is for in Indore, I heard about gila kachra and sukha kachra kinds, right? So that's where the separation comes in, so that you're not mixing everything in, so that they can pick up all your sanitary products and they can then dispose it properly. So it's important. And the reason it is important, I forgot to pick that up on, that this is the impact on environment, isn't it? When we're using disposable stuff, any disposable things that we're using, it will have impact on environment. So we need to have that responsibility as well. Yeah. So the more you inform people around, once you are informed, once you are educated about this issue, the more you can inform others. That would be fantastic. It's just about one small thing, and that's the ripple effect you can see around you. The people are opening up, people are talking about it. Yeah. Can we go to the next one? Irene?
Yes, ma'am. Yes, ma'am.
Okay, so we've talked about what menstruation is all about. We talked about why it is important, an issue. We talked about why, what are the symptoms, if at all there are, and how do we manage it. And once menstruating, what is it and how hygienically we should be practicing during that period, and how do we dispose it. Now the question is, as a society, men, women, young, age group 16, 18 to 60, 65, what can we do about it? What can we do about it? It's nice to talk about these things. It's fantastic, but what do we do? One action that is important, isn't it? So when we talk about discriminatory practices, and can you give me an example of what kind of discrimination do people or women have sort of succumbed to or have experienced?
Ma'am, they're not allowed to enter into temples and everything. They're not allowed to go into the kitchen. They're not allowed to sleep on the bed and things like these.
Do you think they still exist in this modern day?
Ma'am, modernism, I think, is only relevant when we talk about the urban areas and urban families. But even in urban families, the people with a rural mindset, and especially in rural areas, I think it's still prevalent in large numbers.
So if you think about it now, that again, there is no right and wrong answers in our lives. There's no right and wrong. This practice was right many, many years ago. Many years ago, this was right when our grandparents, grandmoms used to fetch water from far areas. They used to chop everything from their own garden or agriculture. So they were doing quite a lot of physical activity. Yeah. So this was the practice, so that there is a respite for them for next 5 days, at least as a little rest to their body. Yeah. It never started as discrimination. This practice was started as a support. But what really happened was that we moved away from fetching water to our direct tap water. We have moved from getting the crops from our agricultural land to home delivery online, but we continued with this practice. Yeah. So that is one question about 5 days not entering the kitchen. That was the reason why. But then we have never ever questioned that practice. And that is something I would urge all of you to always question why. What my mom did, I'm not doing it because things have changed. What my grandmother did, what my mom didn't, because practice changed. And we need to question why. Why there is a practice like this? If we don't agree with it, why? Yeah. So any other discriminatory practice that you have thought about or experienced? Anyone else? No?
Excuse me, ma'am. Ma'am, sometime I was asking my mother, but she said that it was a scientific reason, and as well as it was rituals which is coming thousands years.
Yes, absolutely. So that at that time it was scientific reason because we needed to give them some rest, isn't it? Because they were doing quite a lot of physical activity. Yeah. But now the rituals have been coming or given to us or propagated through generation to generation, right? Is it not our responsibility to stop and ask why? If thinking about the rituals, thinking about the religion, thinking about anything really, I might be politically incorrect here, but think about that if you believe in God and if you think that God has given you this female body and the God has given you this physiology, then what is wrong about it? It's just about questioning. I'm not saying parents are wrong, society is wrong. I'm not saying that. What I'm saying is we need to question. If we don't question, we continue to use the practices which we do not agree with. Yeah? So what we need to do is we need to talk. We need to talk about it at home, at work, in school, in your neighborhood, with your maid. We need to talk. First step. Second step is to support. So any girl in your life, any woman in your life, we need to support. Especially this is true for men. I think women together, they support each other. They might not support 410 different things, but when it comes to periods, they will support each other. Without a doubt, they will hold hand. But I think with men supporting women in our lives, it's important. Now, I like to question this. Daughters, they're very close to their fathers. Yeah. Birthdays, Dad, I want this. And dad says yes. Sons are very close to moms. They demand, mom cooks. Very common. How many times we have talked about menstruation? As a father, daughter, son, and mom. Something to think about. If your mom is feeling a little bit iffy or your wife is feeling a little bit iffy, it's important to tell them. Yeah? If you need bread in your house or you need a paracetamol, your dad coming back from office or your brother coming back from university, you call them and say, can you bring a loaf of bread? How many times you have asked them to bring a sanitary pad? Simple question. Very, very simple question. And if you haven't, not because you want to ask, Do you feel confident in asking them? And if you do, does the chemist feel confident in giving them? And when they give them, would they wrap in a newspaper, then put it in a black polythene, and then hand it over? So this is for you as if you're dealing with drugs. Just a sanitary, it's an innocent sanitary napkin, isn't it? Things to think about. Just stop and think. Yeah. So any discriminatory practice during menstruation in our families, in our neighborhood, we need to question. We're not the police. We're not the social police. I'm not going to say to your family, you're doing it wrong. No, this is not my job. But my job is to ask, at least give them an opportunity to stop and think. Talk about it. Support women in your life. Mom, sisters, sister-in-laws, daughters, anyone around. And then celebrate. Think for a minute when a woman is menstruating and she misses one period. What is the thought comes in? Am I pregnant? Yeah. So menstruation gives you the power to create a life. You are very powerful. You're very, very empowered because you have the ability to create a life, not anyone else. There might be 110 sperms around you, but it is your ovum that is get fertilized. So be proud of it. Wrap the gift and carry with yourself. Feel the womanhood, feel that power, and be proud of it. And be proud of every woman in your life. To say, you know what, we are the ones who have the power to move on and create life. And understand that there is a physiology and there is a psychology. Yeah. So when we talk about longer psychological issues, they are very, very entrenched. We cannot change it straight away. But opening a dialogue is important. So I always said, it's very important to ask whys. And that's where my first sort of presentation slide was about why. Why I'm here. What makes me someone professionally to come and talk about it? Why do we menstruate? Why do we discriminate? Why do not we talk about what are the barriers? These are things. And I'll leave it with a thought we've talked about is there are men in menstruation. Yeah. If you look at the spelling, there are men. So let's bring our men in this discussion. Let's bring our men in this conversation. It's important. Without them, we can never have a complementary relationship with this. Yeah. Half the people, half the planet is bleeding, but we don't talk about it. Thank you very much. Any questions?
Yes, ma'am.
Yes, ma'am, I do have one. Ma'am, I wanted to ask that which three of them is best to use for personal hygiene: pads, menstrual cup, or tampons? And is it harmful to use tampons and menstrual cup?
So, first question is which one is the best for hygiene, right? So, for hygiene, you can use anything. Three of them are hygienic as long as you change them regularly. Yeah. And you look after your general cleanliness. So with pads, they are much more convenient. You just have to put it on and run away. Tampons takes a little bit of time because you have to insert it in the vagina. Yeah. So you possibly would feel a little bit of discomfort when you start first. Once you know how to use it, it becomes so much easy that you can do anything. You can run, you can jump without even knowing. But again, it's important that you do change it every 4 to 6 hours. Because if it is there for longer period, again, the potential is of infection. Menstrual cup is fantastic. It's about the technique. It's a new product in a way. But if you know how to use it, and once you've practiced it, nothing like it. It's like you're saving environment. You less chance of infection, and generally quite easy to use. So from my point of view, it's your choice. You are aware now that we have these things. It's your choice. What is right for you is right for you. Yeah?
Okay. Thank you, ma'am.
Okay.
Ma'am, next we have Rosemary Lakra with her question.
Good evening, ma'am.
Hi.
So, ma'am, my question is that people say that girls should not eat sour foods. So, why girls are prohibited to eat sour foods like curd, pickle, tamarind? Do it affect the girl's body?
Well, that's what I asked, isn't it? Why? When you eat pickle during your periods, does it happen that you experience something extraordinary?
No, ma'am.
No. So eat everything that you want. It's your body. Eat what you like. How is it eating a char, putting that on your tongue is going to make a difference in your bleeding uterus? What's the rationale? Yes, as I said, if it doesn't help you with, say, you have acidity or something, so it's a comorbid condition. You have something else that is happening in your body. So let's not mix two things, yeah? So if you want to eat pickle, if you want to eat hot stuff, go for it. If your body allows, if you like it, just go for it. And again, if someone next time asks you, don't eat pickle or don't eat curd, ask why. And when they question and they say, this happens, ask, who has experienced that? And then you eat it. And if you experience it, it's your choice. But scientifically, no evidence doesn't suggest anything like that.
Thank you, ma'am. Next we have Anjali Mukati with her question.
A very good evening, ma'am.
Good evening.
My question is that in India, girls miss school and even drop out for it because of menstruation. What innovative can we take to overcome this situation?
I think it's a very big sort of issue. And we generally cannot do sort of change in mindset straight away. And that's where my question comes in, is about asking why. With your underprivileged people, when you have maids around you, asking, having conversation about it. Their daughters or your cousins or your sisters, anyone you find, especially I think with urban, it's not an issue. With families like yourselves, it's not an issue. But yes, overarching rural population, talk about periods. Talk about that this is going to happen, but this is normal, natural. This is normal progression of any womanhood. When I am prepared, it's very simple example I say. When I drive to a new place, I become anxious, right? But if I know exactly from my house to that new place, it will take 20 minutes and there is a parking space, my anxiety goes away. And I think everyone has experienced that. Knowing something that's going to happen and how to manage it helps a lot of people. So when we're talking about dropouts, if we can talk about the menstruation to moms, and if we can talk about menstruation to girls, and to say this is normal, and then if you can facilitate some sort of facilities, clean water, toilets, yeah, sanitary napkins. And now there are so many NGOs who are willing to give sanitary pads to them. So it's just about supporting them. And once you've supported and they say, still we don't want to go, then the question comes, why? Is it only menstruation or something social going on? Yeah? Is that all right, Anjali?
Yes, ma'am, please
Yes,
continue.
ma'am. Thank you, ma'am.
And next we have Shreya Parteti.
Good evening, ma'am.
Hi.
Ma'am, my question is that many women during their period feel lack of energy and tiredness. So why is it so, and how can it be overcome?
Okay. If you remember, when we talked about symptoms, so as I said, some people will have that symptom of feeling a little bit lethargic, and that is the effect of the hormones. Yeah. So the interplay of estrogen and progesterone, and it's the period when you're ovulating and post ovulation, you will feel lethargy. Not everyone, but if you feel that, how do we manage it? One is, we know that you're having periods. We need to look at how do we manage it. Bring something interesting in your life at that point. If you need to sort of take medication or something, that is fine. But generally, if you're just feeling low, lethargic, then maybe thinking about going for a cup of coffee with your friend on that day. Because for that, you will have to literally get up, look after yourself, and go out. Yeah. And second thing is about knowing that it's just a phase, another day, and tomorrow I'll be fine. But again, it all depends on my personal experience has been that whenever people have any kind of physical or psychological symptoms, if they start their physical activity, they did notch it up a little bit 2 or 3 days prior to their periods, they will not experience any symptoms at all. Or if they struggle with symptoms, it will be very minimum. Yeah. Notch up your physical activity. Start going for a walk or a run. Shreya?
Yes, ma'am. Yes. Thank you,
Okay.
ma'am.
Thank you, ma'am. Now we have some really quick questions from our live chat audience. So Miss Priya asks that as we talked about the alternatives of sanitary pads, that is menstrual cups and tampons. So if they are good or not, she asks. And then she continues saying that if yes, then at what age we should start using them?
Okay. So well, there is no age for using for sanitary pads. Any age is good, isn't it? For tampons and cups, again, it's not about the age, it's about the size. For tampons as well, you will have different sizes. For cups also, there'll be different sizes. So it's about trying it and seeing whether you feel comfortable with it or not. Some people have experience, in my sort of social network, have reached to a point where they have given birth to 2 or 3 children, but still don't feel confident using tampons, and that's the choice. They've tried, they felt it wasn't for them. But with regards to age, there is no age. They can use anytime, and they are
Okay,
safe.
ma'am. Yes, ma'am. The next question is from Miss Adhaya. She says that I menstruate for 15 days. I know that is abnormal. What should I do? Take any professional help or something?
Yes. So as we talked about 28 and 5, the 28-day cycle, 5 days of your menstruating period. And it can sort of vary a little bit, but if you menstruate for 15 days, that simply tells you that there is a little bit of hormonal imbalance. Because if you are menstruating for 15 days, that means you will lose 3 times the blood that any average woman loses. So there is a potential of anemia. So you will feel lethargic. Third thing is you should be taking a professional help because there can be multiple reasons for longer period. However, these are very fixable issues. Either sometimes a small sort of dose of hormonal tablets can bring back the cycle back to normal, or sometimes if it is really sort of, again, it would be difficult for me to say, following the investigations, if you need, then you possibly will need a surgical intervention as well. But again, I'm not going on to surgical side of it, but I think if you get a professional help, that would be really helpful, because you don't want to bleed 3 times the blood. It's not normal.
Okay, ma'am. The next question is from Miss Anaya. I am an athlete, and why can't we do heavy exercises at the time of menstruation?
Who says that you cannot do heavy exercises? Heavy exercises means what? It is quite relative, heavy exercise. So I don't know. Heavy exercise means what? Someone who doesn't lift any weight and lifts 10 kilos of weight is a heavy exercise. Someone who lifts 40 kilos of weight every day, then lifting 10 kilos is not a big issue. So first thing is heavy exercise. I don't understand what you mean by that. Having said that, during your period, it's about listen to your body. If you have any protection, if your body allows you and you feel good about it, do whatever you feel is good. There is no rights and wrongs. Your body knows when you need to work out. Your body knows when you cannot. And if your body says, I cannot take an extra kilo of another weight, leave it there. So you can exercise without any problem. You can go for swim, you can go for a run, you can go, even you can lift weights. Again, depending on how your body sort of responds.
Okay, ma'am. The next question is from Miss Shreya Vichare, and she asks if there is any relation between eating junk food and your menstrual cycle.
Not sure about eating junk food and menstrual cycle, but yes, eating junk food and feeling dysphoria, definitely, because if you eat junk food and high sugar diet, and during the period you are not eating high sugar diet, so your sugar rush has gone down, plus on top of that you're feeling dysphoric as well. But there is no direct sort of relationship to your menstrual cycle or your sort of days of how many days you will bleed. There is no direct relationship to that. But for a general healthy lifestyle, it's just about curbing the junk food generally.
Okay, ma'am. Now, a lot of our audience has asked if you could aware us about PCOD.
So PCOD is a hormonal sort of condition, yeah, and it is more about ovulatory hormone, ovarian hormone. The issue with PCOD is that your cycles, your menstruation will be irregular. So if you think that I think the first thing what we need to think about is about recording your cycles, whether they are how long the cycles are. Yeah. Thinking about your periods as a sacred act, sacred, I would say, it's a cliche, it's a period. So if your periods are not regular, what are the reasons? So when we talk about hormonal imbalance, it's not just the menstruation, it's about the imbalance in your testosterone, estrogen, and progesterone, and how your ovary reacts to it. Sometimes there is no ovulation. So if there is no ovulation, your uterus is not preparing for pregnancy. And because when your uterus is not preparing for pregnancy, there is no sloughing of the failed pregnancy. And that is what, in very nutshell, very simple terms, PCOD is all about. So if you think that your cycles are not regular, they are missed, there are multiple missed periods, multiple months, go and get yourself a checkup, please, especially the hormonal investigation. And once that is sorted, you can be put on to hormonal therapy for maybe 6 months or so, and the cycle comes back.
Okay, thank you so much, Devna ma'am. And now that we are done with this session that kept us so engrossed, and firstly, I would like to thank Devna ma'am wholeheartedly for satiating all the queries and curiosities so well and so clearly. It has helped a lot and might have helped a lot of people to remove their mental barriers and contributing towards awareness. Now, just as an ocean comprises the value of every drop, similarly, a successful event always incorporates the combined events of an effective team. Hence, I call upon Dr. Meghna Riker to propose a vote of thanks for our today's webinar. Ma'am, please.
Thank you, Rishita. This thank you gesture reflects the sense of recognition, which is essentially good to express gratitude. I, Dr. Meghna Riker, regard it as my pleasure to propose the vote of thanks for today's successful and indeed an insightful webinar conducted by an internationally acclaimed resource person. First and foremost, I ardently thank the Almighty God, the supreme power beyond us, for giving a reason for all of us to gather here in an informative session. Then I express my sincere gratitude towards our Honorable Director, Reverend Father Simon Raj, and respected Principal, Dr. Sister Alice Thomas, for their constant motivation, support, encouragement, and providing endless opportunities and platform to keep us aware and intact the knowledge gathering process. I also extend a heartfelt thanks to the HOD, Professor Rahat Ahmed, and the fellow professors for their constant support and guidance to organize the fruitful sessions. Now, I extend a note of unfeigned gratitude towards the pole star of today's program, my dearest friend, a dedicated gynecologist, a well-known psychiatrist, and very amiable person, Dr. Devina Tyagi Sharma, for accepting our invitation and for sharing the ocean of knowledge about today's topic. What is that topic? The topic is menstrual health awareness, breaking the taboo. Your valuable advice and handling with this taboo subject indeed spread awareness among the youth. On behalf of Humanities Department, a big thank you to you and best wishes for your successful future. An event without the viewers is just like a classroom without students. So I would express my sincere thanks to the enthusiastic audiences, to the students for turning this international webinar into a resounding success with their presence and interactions. Finally, but importantly, I would like to express my gratitude towards the technical team for enabling the smooth conduction of the webinar. Once again, I sincerely acknowledge each and everyone from the bottom of my heart. Thank you so much. Thank you, Devina. Once again, thank you so much for accepting the invitation.
Pleasure is all. Thank you very much.
Yeah.
Thank you so much, Meghna ma'am. A very short announcement that after this session, feedback link will be given, and fill it carefully and you will receive your e-certificates within 7 days. So if any mistake is made in the feedback form, you will be responsible and you may not receive the certificate. So please make sure that you do not leave the group until you have filled the feedback form.
Yeah.
Now, dear audience, as we finally depart from this really fruitful session, we hope that the objectives for this session be fulfilled sooner or later and produce a positive change starting from our own four walls. Thank you so much for your participation. And with these final words being said, I, Rishita Shukla, your host, take leave from all of you. Thank you so much.
Thanks everyone once again. Stay happy, stay healthy. God bless all of us. Thank you very much, all of you.
Thank you very much.
Thank you. Bye-bye.
Thank you, madam, also. Once again, Devina madam, thank you very much.
Thank you. Welcome.
Thank you so much, ma'am. Thank you.
Thank you so much, ma'am.
Can I leave the
Yes,
meeting
yes,
now?
yes. Bye-bye.
Bye.